It seems like there's a new story every week about some billionaire trying to extend their lifespan. And where better to investigate whether the ultra-wealthy and powerful are going to live forever than Davos, Switzerland, where every January the ultra-wealthy and powerful, and this year me apparently, converge because of the World Economic Forum. I'm Andrew Steele, biologist and ageing expert, and I believe that real anti-aging medicine is coming soon. So I want to find out, will these treatments only be available to the rich? With everyone from the founders of Google to Amazon founder Jeff Bezos funding longevity science, I can see why people might start to get the impression that hoping to slow down aging is the dream of the ultra-wealthy. So is a dystopia with an immortal Jeff Bezos enslaving the rest of us, literal mere mortals, in a giant Amazon warehouse something we need to worry about? I want to explain the science and the economics that make me optimistic that these treatments will be available for the many and not just the few. I'm on my way to something called the Longevity Investors Lunch here in Davos. And I think looking at the programme for this week gives the lie to the idea that the global elite are obsessed with living longer. Out of hundreds of events happening here, I could only find 2 or 3 that are directly related to ageing biology. If you think about billionaires, out of several thousand billionaires worldwide, only a handful invest any significant fraction of their wealth into anti-aging research. And to me, that suggests that billionaires are shockingly unobsessed with longevity. If I was a billionaire, I'd give away 995 million of my wealth to researching ageing biology. Guess maybe that's one reason I'm not a billionaire. Anyway, I'm going to get to this event and see if I can convince some wealthy people of just how important this stuff is. While I was at the lunch, one of the other speakers showed the results of a really fascinating survey that I'd actually not seen before. UBS asked 5,000 very wealthy investors how much of their wealth they'd be willing to sacrifice for an extra decade of healthy life. The answers ranged from about a third in the $1 to $2 million bracket up to basically half for those worth 50 million plus. After all, only 25 million is still plenty enough money to keep yourself entertained in an additional healthy decade, right? So the good news is the ultra-rich do care about their health. The bad news for them, and I think for the rest of us, is that they're not putting their money where their mouth is. I think that part of the problem is that those who are obsessed with longevity are taking completely the wrong approach. The problem was explained neatly by a question a journalist asked me a while ago. With infinite money, could I buy immortality? And the answer right now is no. Even with access to all the latest science and the world's best doctors, we simply don't have the technology in 2024 to make people reliably live to 100 in good health, let alone become immortal. In fact, in that same survey, UBS found that more than half of the investors surveyed expected to live to 100. I couldn't find details of how old the survey respondents were, but this is likely to be a huge overestimate for some. An average 60-year-old woman in the UK has a 6.2% chance of living to 100, and a man just 3.5%. Yes, being wealthy, following all the best health advice and having access to the best and most expensive medical care will increase that a bit, but it's very unlikely to increase it to a 50-50 chance, at least with current medicine. So, if I had infinite money, well, if it really was infinite, first I'd do a few completely extravagant things like build a holiday home on the moon, but I'd put the rest into longevity research, which would not only have the best chance of increasing my lifespan, but also that of everyone I care about and everyone around the world who I've never met. So I hope I've convinced you that the ultra-rich aren't as obsessed as the media would have you believe with living forever. But still, if these amazing longevity medicines are developed thanks to funding from ultra-rich people and maybe me and my moon base, could the resulting treatments be so expensive that only billionaires could afford them? Well, there are a few good reasons to hope not. The first reason is that some longevity medicines will just be very cheap. For example, one proposed anti-aging drug is metformin, which is one of the world's most widely prescribed medications, and it's currently given to patients with diabetes. It costs pennies per pill, according to the current prices used by the NHS in the UK. So if we do a clinical trial and find out that metformin does indeed work for longevity, we could roll this out immediately and very cheaply. But not all longevity medicines will be cheap drugs. What about new cutting-edge treatments like gene therapies or stem cells? At the time of recording, the most expensive gene therapy is Hemgenix, a gene therapy for haemophilia. and that costs a cool $3.5 million for a course. If longevity therapies cost more than many people's lifetime earnings, they're not going to be available to the likes of you and me. So let's examine why these things are expensive, and see why that gives us hope that longevity drugs might not be. The first reason that medical treatments can be expensive is the patent system. The idea behind a patent is that if you have a great idea, you can patent it, and then that gives you a certain period, usually around 20 years, during which only you are allowed to produce it, giving you time to make a big profit on your great idea. After the 20 years are up, though, anyone can copy it. There are definitely problems with patents, but that's too big a subject for this video. But broadly speaking, this is how things are meant to work. And what that means is that when a pharma company develops a drug, they normally have something like 2 decades to recoup the money they spent developing it. And developing drugs has been getting increasingly expensive, with an average cost of $1 to $5 billion per drug that makes it to market, depending on who you ask. Once a drug is off patent, it can then be produced by anyone. And drug manufacture is just chemistry. I know, I'm sorry to any pharmaceutical chemists watching, it is very clever chemistry. But what that means is once a team of genius pharmaceutical chemists have worked out how to make something, it's often very cheap to actually make it. So when patents end, drugs tend to get quite a lot cheaper, as competition between multiple manufacturers drives the price down. The other reason companies are able to charge so much for treatments is the way healthcare systems price them. Firstly, there's the US healthcare system, which has a lot of its own specific problems and that we won't go into in this video. But let's take a look at the NHS in the UK, which often gets the same treatments approved as the US, but for substantially lower prices, because of its enormous collective negotiating power. It's essentially a single provider system for almost 70 million people. And the NHS has a very transparent treatment pricing policy. They'll approve a treatment if it saves one quality adjusted life year, or QALY, for £30,000. Okay, what does that mean? Well, one QALY is the equivalent of 1 year of healthy, high quality life, while a year in terrible pain or with serious disability might be just 0.5 QALYs, and so on. So, if a new drug costs £100,000, but it gives someone 5 extra years with a quality of 0.8, 5 times 0.8 times 30,000 means it's delivering £120,000 worth of value. And 120,000 is greater than the sticker price of 100,000, so it will be approved. So, imagine you're a child with haemophilia. Without treatment, you're quite likely to bleed to death early in life, or face a lifetime of disability and pain. And the best non-gene therapy treatment involves an IV infusion 2 or 3 times every single week of your life. And even that doesn't provide a complete cure. That means that a gene therapy that allowed people with haemophilia to live a normal, pain-free 80-year life could be hugely valuable. 30,000 times 80 is £2.4 million. Oh, and by the way, those IV infusions cost over £100,000 per year, which could be another £8 million over an 80-year life. So a significant quality of life improvement, plus reducing costs to the medical system, mean that even if a gene therapy for haemophilia costs a few million, it could save both lives and money. So these enormous sounding prices actually represent how much healthcare systems are prepared to pay for treatments, which is based on how much they're worth in terms of improvements to health. The more relevant question in the longer term, and when it comes to anti-aging gene therapies, is how much do they cost to make? If it's a simple gene therapy that works the same way for everybody, maybe, for example, giving us an extra copy of a longevity gene or deleting a gene that shortens our lives, they could be really very cheap. For example, mRNA vaccine technology is one way that we could deliver gene therapy, if we change the RNA messages inside to have instructions for a gene edit, rather than instructions to build a coronavirus protein. And the mRNA coronavirus vaccines were estimated to cost $1 or $2 per shot. Imagine if the same technology would make you live a couple of years longer. I'd happily pay $1 or $2 for that. Other treatments, like something custom made from a patient's own cells, will be more expensive. One example is what's called CAR T-cell therapy, where a patient's own immune cells are modified to fight their cancer. Though the sticker price for these therapies runs into the hundreds of thousands of dollars, the production cost is estimated to be only tens of thousands. That's still expensive, but not totally out of reach if you only needed the treatment once every decade. And the processes for making these therapies are currently almost artisanal. Highly paid technicians manually dripping chemicals onto dishes of cells with another highly trained technician looking over their shoulder, literally counting the drops to make sure the exact protocol is followed. This is a process crying out for automation, and therapies like this will surely get much, much cheaper with time. The other reason drugs for aging are likely to be cheaper is the potential market is so much larger. Where a CAR T-cell therapy might be useful for a few patients with a specific type of leukemia, which is really quite a tiny number of people, an anti-aging drug would have a potential market of every living human. This would mean that companies would have enormous economies of scale and much more incentive to carefully optimize processes for cheap and safe mass production. We see this with loads of different technologies. Computers, mobile phones, renewable energy. Solar power got cheaper by almost a factor of 10 in the decade from 2009 to 2019, as companies manufactured more and more panels and learned how to do it more cheaply and effectively. Obviously, we can't guarantee that treatments for aging will follow the exact same cost curve as solar panels, but the basic principle is the same. The more of something you make, the more you learn about how to make it more cheaply. And the other bit of good news is that pharma companies will be incentivized to make things cheaper, to take advantage of the mass market. Imagine you create an anti-aging regimen that costs, say, $2 million a year, and then you manage to sell it to the roughly 3,000 billionaires that exist in the world. That's about $6 billion in potential revenue. Now imagine instead that you create something that costs $2,000 per year. That's 1,000 times cheaper, but you can sell it to, say, half of the people in the rich world. That's 500 million people, so potentially a $1 trillion market. Selling to billionaires just isn't that profitable, just because there aren't that many of them. There's also good reason to hope that governments will subsidize these treatments, because ultimately they'll save money. If you can create preventative medicines for aging, this will mean that people get less cancer, less heart disease, less dementia, and so on, saving us some of the trillions that these diseases cost the economy every year. Healthcare systems will need to spend less on treatment and less on long-term care, which is really expensive. And fewer people will need to quit work because they become ill or go part-time to care for an elderly relative. And this is a huge incentive to make sure that these treatments are as widely accessible as possible. Finally, I think there's a good argument that the first real anti-aging treatments can actually help poorer people the most. That might sound slightly counterintuitive, so bear with me. Let's start within countries. In the US, the richest 1% live almost 15 years longer than the poorest 1%. There are obviously many factors driving this difference, but lots of them, like a lack of free time to exercise, less access to healthy food, more stress, less sleep, higher rates of smoking and drinking, and so on, are, biologically speaking, basically accelerated aging. We should absolutely be doing public health programs to help the less well off have access to the healthy lifestyles that many wealthier people enjoy. But we have been trying this for decades, and we know it's really, really hard. So I'd be far more optimistic tackling health inequality with a real anti-aging drug in my back pocket that could augment the lifestyle changes. There's also a life expectancy gap between countries, and we in the rich world have a moral duty to ensure that people around the world have access to longevity medicine. If we can pull this off, I think there's a good case that it could benefit poorer countries even more than rich ones.
The reason is the numbers. In high-income countries, life expectancy averages 81 years, and spending on healthcare averages almost $6,000 per person per year. But globally, most people live in middle-income countries. These have an average life expectancy of 72 years, not far off the 81 in the rich countries, but an average GDP per capita, which is a measure of the total activity of their economy every year, of $5,400 per person. So they'd need to spend literally all of their money on healthcare to get a comparable level of service to most rich countries. And their populations are already reaching old enough ages that they're going to need that kind of healthcare pretty soon. So if we could help low and middle income countries reduce their levels of illness and frailty as their populations age, this could be a huge win for development.
The final point is my favourite general argument that you can use for most ethical questions when it comes to aging biology. Is to turn the question around. Imagine we lived in a world where billionaires were living forever,
And the technology was so expensive that the rest of us were living to currently normal lifespans, like 80 years old or whatever. Ultra-wealthy individuals living hundreds of years were using that time to accumulate ever more money, and inequality was at levels never seen before in human history. Would you really try to solve that growing inequality by killing billionaires, by slowly aging them to death? I can think of a few things I'd like to try first, like changing the tax system, using that money to invest more in science funding to develop ways to try and make the treatments cheaper, and so on. And if all of that didn't work, are we really so spiteful to kill people just because they're rich and they can live longer than we can? I think there are lots of good reasons to think that this inequality dystopia will never happen, and I hope the rest of this video has convinced you of that too. But even if it did, I think we're better than killing the rich just because we can't have what they've got.
Just finished my talk, taking a walk through the beautiful evening in Davos. The sun's just going down and... oh my God, who's this? It's Ordinary Things.
All right, mate. The bell tolls for thee. Not a good sign for longevity.
So Ordinary Things, I did not expect to see you in Davos. What brings you here?
I am working on a documentary about longevity and how not to die.
Well, that's a pretty compelling tagline, and we'll stick a link to that in the video description and all that normal stuff. But I just wanted to ask you, like, this isn't really your field, right? How did you get interested in this stuff?
Well, like anyone, I am interested in sustaining my heartbeat for as long as possible. So there is that. I see myself as like Cortez looking for the fountain of youth, but trying to find a real one rather than a fictional one. But also, yeah, it's not my normal kind of thing, but I'm always interested in people who either think they can see the future or people who think they can make the future. And I think that brings forward the most delusional people, the most fanatically minded, but also, yeah, the pioneers. And I feel like I'm early here. I feel like this space has got a host of them. I don't have the scientific knowledge to figure out who's who, but I think with enough time and talking to experts like you, I might be able to figure it out.
We're in this environment. Davos, the World Economic Forum, is happening around us as we speak. Longevity is a topic that often gets sort of tangled up with the ideas of the global elite. Are they going to live forever? Billionaires. You know, what do you get from the vibe here? Do you feel like this is something that's on the top of the list for people who are very wealthy?
Well, to be fair, there is a big wall with armed guards down there that I've not been allowed to go in. So I do feel a little salty about the global elite. But look, you know, a lot's been said about how, like, I'll often say in my videos, trickle-down economics doesn't work. Because, yeah, it doesn't. You give money to the rich, it doesn't necessarily travel to the people who need it the most. But ideas, technology, yeah, that does tend to trickle down eventually. Yeah, it might take a decade or so. And so I think these arguments of just like, well, isn't it terrible that maybe billionaires might live forever? And like, okay, number one, sweet, even if it is just billionaires, just the fact that there would be a 200-year-old man alive one day is just...
I mean, as long as it's not Elon Musk.
Hey, you know, well, it could be someone worse. But equally, maybe you're right. Look, but someone's got to do it first. There's always going to be these pioneers. And like, frankly, if someone's going to spend a whole shitload of money on something, I'd rather it be something like this than, I don't know what, like a monument to your own face or a football stadium in the middle of a desert somewhere. That's a waste of money.
Just pick a random example.
Yeah. But going to space, trying to live forever, hey, I'm on board with it. If someone's, to me, that's what billionaires are for.
And what do you feel about the ethical challenges that this field throws up? Because I get asked a lot of these ethical questions, and I know it's really interesting to chat to someone who's coming to this fresh. You know, I've been steeped in this stuff for like 10 years. I'd be fascinated to go back and speak to myself 10 years ago before I'd really got into this stuff. So I'm going to use you as a proxy for that. You know, how do you feel about the ethical challenges?
Well, I've always been quite comfortable in ethically murky environments. I think that's where the most interesting people are. And quite frankly, I find people who are high on their own moral high horse quite dull and uninteresting. I'm comfortable in the morally murky. I think this is a fairly morally murky environment. I think there are con men, there are snake oil salesmen. But I'm not making a documentary about Mother Teresa. I'm making a documentary about, yeah, maybe some underhanded people, maybe some delusional people, but also I'm hoping that there is pioneers among them. Because I believe in their cause. I believe in this. I think longevity really is the silver bullet to a lot of society's problems, and also my fear of death. So, you know, for personal reasons, I'm interested.
And imagine we did develop the cure, people could live substantially longer, healthier lives. Do you think that would throw up any ethical problems of its own?
Yeah, certainly. I mean, there's the overpopulation question. Will there be enough food to feed people? But I see that's a good problem to have, ultimately. And yeah, maybe there are solutions to that problem. And so progress is never a straight line. I say sometimes that my channel is a study of progress. A satirical one, admittedly, but progress, the internet is such a great example of that. The internet, is the internet great? Yeah, I make all my money there. I'm pretty happy with it. Does it mean there isn't problems with disinformation, pornography, gambling? Yeah, it's all there. Progress is never a straight line. I think this sector and the world that surrounds it is only going to become more relevant in the next 10, 20, 30, 500 years.
Wow. Ordinary things. Have fun in Davos, mate.
Thanks for having me.
What a lovely surprise to meet the brilliant Ordinary Things here in Switzerland. I highly recommend you go and check out his channel if you haven't already. And of course his new documentary on the incredible pace of the current longevity trend. It was also great to meet someone who's coming at this subject pretty fresh, not like me who's had 10 plus years to think about it, and who nonetheless still has an optimistic view of where this field is going. And I very much hope that anti-aging medicines will soon be an ordinary thing, available to everyone, not just billionaires. So head here to check out the new longevity doc from Ordinary Things, or if you want to learn more about aging biology from me, check out this video. Right, I want to try and find someone with a net worth over $50 million and convince them to donate half of it to aging research.